Knock, knock, knock. First, I'm going to wash my hands and put some gloves on. Hi, my name is Peyton. I'm going to be the student nurse practitioner doing your exam today. Do you know what brings you in today?
Just getting a physical.
Yeah, we're going to do a full head-to-toe assessment. Are you ready to begin?
Yes.
Okay. First, I'm going to start with your eyes. I'm going to first inspect your sclera. It is white. I'm going to look at your cornea, your lenses, and your iris. Both eyes are symmetrical and equal. They are blue in color. Next, I'm going to look at your convexual sac. I'm just going to pull down, and I don't notice any swelling, discharge, redness with that. Next, I'm going to look at your cranial nerve at number 2, your optic. I'm first going to look and see if your eyes react to light. So I'm going to have you look straight ahead, and I'm just going to shine this light in your eyes. Good. And the left reacts to light. It goes from 3 milliliters to 2 milliliters, and the right reacts to light as well. It goes from 3 milliliters to 2 milliliters, and they are consensual. Next, I'm going to test cranial nerve number 3, your oculomotor, number 4, your trochlear, and number 6, your abducens. I'm going to do this by testing your cardinal fields of vision. So I'm going to have you look at my finger and just follow my finger. And I don't notice any lag or nystagmus with that. Next, I'm going to see if your eyes have convergence. So I'm going to have you follow my finger to your nose. And they do have convergence. Next, I'm going to see if they accommodate. So I'm going to have you look at my finger and then look off in the distance and come back to my finger. And then the other way. And they do both accommodate. Next, I'm going to look with the ophthalmoscope. I'm going to look for the red light reflex. So I'm going to be look straight ahead. I'm going to come in at a 15-degree angle, about 15 inches away. And I do note the red light reflex. I do note the red light reflex. And next, I'm going to come in close, and I'm going to look at your optic disc. And I do note the optic disc. It is no hemorrhaging, is round and equal. And I do also note the arteries and veins as well. Okay, and next I'm going to move on to your head. So I'm going to first inspect your facial and your head, and it is symmetrical. Next I'm going to inspect your hair and your scalp. And your hair is brown in color, it is thick, it is evenly distributed throughout. And I'm just going to move around to inspect your scalp. And I don't notice any lesions or dandruff or infestations. Next, I'm going to palpate. I'm going to palpate for any tenderness, masses, swelling, or lesions. And again, I don't note any of those. Next, I'm going to move on to cranial nerve number 5, your trigeminal. I'm going to touch 3 areas on your face and just let me know if you can feel me touching. I'm going to start with your ophthalmic. Do you feel that?
Yes.
I'm going to move to your maxillary.
Yes.
And your mandibular.
Yes.
Next, I'm going to have you clench your jaw for me. And I do note a strong jaw clench. Next, I'm going to move on to cranial nerve number 7, your facial. So I'm going to have you close your eyes really hard. Don't let me open them. Okay, and raise your eyebrows up. And puff your cheeks out. And smile. And stick your tongue out. Okay. And next, I'm going to palpate and percuss your sinuses. I'm going to start with your frontal. Let me know if there's any pain.
No.
I'm going to percuss. And I'm going to move to your maxillary. I'm going to palpate.
No pain.
And percuss. And no pain noted there.
No.
Next, I'm going to move on to your nose. So I'm going to first just check for patency. I'm going to be breathing in and out. Breathe in and out. And I'm going to have you smell this. Let me know what it smells like. Close your eyes. Smell?
Like Sharpie.
Correct. Cranial nerve number 1, your olfactory, is intact. Next, I'm just going to inspect. All right, I'm going to take a look inside. I'm going to lift up, and I don't notice any nasal polyps, discharge, swelling. Your septum is not deviated. Okay, next I'm going to move on to your ears. First, I'm going to perform the whisper test and test cranial nerve number 8, your acoustic. So I'm going to come behind you. I'm going to press in one ear and whisper in the other.
1, 2, 3.
And again on this side.
Hello.
All right, so cranial nerve number 8, your acoustic is intact. Next, I'm going to palpate on the tragus. I'm going to turn you this way. Okay, sit. All right, I'm going to palpate on the tragus. Let me know if there's any pain.
No.
Palpate on the mastoid bone. Let me know if there's any pain.
No.
Okay, next I'm going to inspect inside your ear. So I'm going to pull up on the auricle, upward and backwards, and I'm going to look inside. And the tympanic membrane is gray purplish in color. The cone of light is at 5 o'clock. And I know minimal cerumen. And I'm going to do the same thing on this side. I'm just going to turn you again. Okay. And I'm going to pull upwards and backwards. Look inside. The tympanic membrane is gray purplish in color. The cone of light is at 5 o'clock. And I know minimum cerumen. Okay. And we're going to turn you this way to face the camera again. Okay. Next, I'm going to move on to your mouth. I'm going to start by inspecting the lips. They are pink in color, and whenever you open your mouth, your mucous membranes are moist, and your gums are pink. Next, we're going to test cranial nerve number 9, your hypoglossal. I would perform the gag reflex to test this. Next, we'll move on to cranial nerve number 10, your vagus. I'm going to have you stick your tongue out for me, and I'm going to look back at the uvula. I'm going to have you say, ah. Good. The uvula is symmetrical. Next, I'm going to test cranial nerve number 12, your glossopharyngeal. I'm going to do this, and I'm going to have you stick your tongue out. I'm going to inspect the tongue. It is pink. It is equal and symmetrical. I don't notice any cracks or lesions. I'm going to have you move your tongue side to side. Good. Strong tongue movement. Next, I'm going to look back at your tonsils. They are pink. I don't notice any swelling or discharge. I also note the pharyngeal is pink. I also note the hard and soft palates are pink and intact. No swelling, discharge noted there. Next, I'm going to move on to your neck. I'm going to test cranial nerve number 11, your accessory. I'm going to have you resist against my hand and turn your head. Good. And then this way. All right. And then I'm going to have you shrug your shoulders. Accessory cranial nerve is intact. Next, we're going to move on to palpating your trachea. So I'm going to come and find the CMM muscle. I'm going to come in between that, and I'm going to move the trachea to each side. I'm going to have you swallow and swallow again. Good. It is not deviated. I don't know any swelling or discharge or swelling. Next, I'm going to move on to the thyroid gland. I'm going to palpate to the cricoid cartilage, and I'm going to find the thyroid gland, and I don't notice any swelling or masses on there, and I'm going to have you swallow for me. Good. And I don't notice any swelling or masses. Next, I'm going to palpate your lymph nodes. We're going to start with the preauricle. post-auricle, occipital. I'm going to come down to the parieid, the tonsillar, submandibular, and submental. I'm going to go to posterior and anterior cervical and the supraclavicular. And I don't notice any pain or tenderness or swelling while palpating. Next, I'm going to listen to your carotids for any broods. So I'm going to have you turn your head. And then this way. And no brutes noted. Next, we can move on to your anterior thorax. First, I'm going to inspect. I notice hair is evenly distributed, no swelling, masses, or lesions. I'm going to measure your A and P ratio. I'm going to come over to the shoulder, and then I'm going to come across. And your anterior-posterior ratio is 2:1. Next, I'm going to count your respirations. I would do this for 30 seconds. I'm just going to do 15. Okay, and your respirations are about 14 respirations per minute, and they are even and unlabored. Next, I'm going to take a listen. Take deep breaths for me. Your breath sounds are clear and equal bilaterally. Now we're going to move on to your posterior thorax. So I'm just going to have you stand up, and I'm going to turn this so they can see. Okay. And I'm going to have you lean forward for me so they can see better. First, I'm just going to inspect, and I don't notice any masses, lesions, and it does look symmetrical. Next, I'm going to palpate. I'm going to palpate for tactile fermentus. So I'm just going to have you say 99.
99, 99, 99, 99.
And I do feel the vibrations throughout. Next, I'm going to palpate for expansion. I'm going to go down from C10 to T10. So just take some deep breaths for me. And I do note even expansion throughout. Next, I'm going to percuss for general renaissance. We'll do 8 spots. Okay. And I do note general renaissance. Next, I'm going to take a listen for breath sounds. Take deep breaths for me. And I don't notice any crackles, rails, bronchi, or wheezes. They are cleared equal bilaterally. Next, I'm going to test for agnophy. I'm just going to have you say E.
E, 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 E.
And I'd be looking for the E to go from an E to an A, and I don't note that at all. Okay, now we can move on to your cardiac assessment. I'm going to have you stand up for me. I'm going to have you lay supine on the ground.
What does that mean?
Lay on your back. Come lay your feet all the way. Can we lay this way? Sorry, you just can't see it in the camera. close right here. Okay, perfect. Okay, now I'll move on to your cardiac assessment. First, I'm going to start by inspecting. I don't notice any masses, lesions. Next, I'm going to palpate for lifts with my fingers. No lifts noted. Next, I'm going to palpate for thrills with the balls in my hands. Okay, no thrills noted. Next, I'm going to take a listen with my stethoscope. I'm going to listen at the aortic, pulmonic, Erb's point, tricuspid, mitral. I'm going to listen at the apex. I'm going to count your heartbeat. I do know 62 beats per minute, and it is normal sinus rhythm. Next, I'm going to listen for S1 at the apex, where it's the loudest, and S2 at the base, where it's the loudest. Next, I'm going to listen with the bell for any murmurs, abnormal heart sounds at Erb's point, at the tricuspid, and mitral. And no murmurs or abnormal breath sounds noted. Next, I'm going to find the PMI. I'm going to first inspect with tangible lighting. I'm going to come over to the mid-clavicular down to the 5th intercostal space. I'm going to palpate PMI. Once I find that, I'm going to feel, and it is about 2 centimeters and a soft throb. Okay, next we can move on to your abdomen assessment. First, I'm going to inspect with tangible lighting. I'm going to look for any hernias, pulsations, edema, swelling, none noted. Next, I'm going to listen. I'm going to listen at the descending aorta. I'm going to listen at the renal, iliac, and femoral for any brutes or abnormal sounds, not noted. I'm going to listen in all 4 quadrants for bowel sounds. I hear normal bowel sounds throughout. Next, I'm going to percuss for any dullness or air pockets. No dullness or air pockets noted. Next, I'm going to percuss for the liver measurement. I'm going to come over to the right midclavicular line. I'm going to percuss downward until I hear dullness. Right there, I do note dullness. Next, I'm going to come up from the umbilicus till I hear dullness. Right there, I note dullness, and I'm going to measure. And it is about 4 inches long. And I'm going to verify this performing the scratch test. And my computer just timed out, so I need to re-log in quick. Okay, just to make sure you guys can see. So I'm going to listen and perform the scratch test. By doing this, I'm going to listen for a difference in sound. And I do note the difference there, and that is where I thought, and I'll do the same this side. Do note, and that verifies the correct location. I'm going to have you lay on your right side for me, just a little, right there. Now I'm going to percuss for the spleen. I'm going to come down from the mid-axillary line. Do note there. Do note the spleen. Alright, you're going to lay down for me. Next, I'm going to perform light palpitation. Let me know if there's any pain. Next, I'm going to
No pain.
perform deep palpitation. Relax. 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 Next, I'm going to palpate your superior and inferior inguinal lymph nodes. So I'm just going to pull this down a little. Let me know if there's any pain. Again, on this side. No pain, swelling noted there. Next, I'm going to palpate for Murphy's sign, which is testing for cholestasis. So I'm just going to have you take a deep breath for me. Push out. Any pain? Okay. Next, I'm going to test for appendicitis, which is McBurney's sign. So I'm going to press and let me know if there's any pain. Relax. Okay, and next I'm going to test for rebound tenderness. I'm going to press and I'm going to release and I'm going to see if there's more pain when I let go. This is Blumen's sign and no pain noted there. Okay, next we can move on to your musculoskeletal assessment. So I'm going to have you stand up for me. Oh, sorry, one more down here. I'm going to move to your head. And I'm going to test for Brzezinski's sign. I'm going to let knees down for me. I'm going to flex forward, and I'm going to note for any flexion at the knees or hips there, and none noted, so that is a negative sign. And I'm going to test for meningeal irritation and Koenig sign. I'm going to bring your knee in, and let me know if there's any pain.
No.
And any pain.
No.
Okay. Now I stand up. Okay. So first I'm just going to inspect your upper extremities and lower extremities to make sure they are symmetrical. And they are symmetrical. Next I'm going to inspect your skin over your muscles and tendons for any skin irritation, muscle tendons and ligaments, and skin is symmetrical as well. Next, I'm going to inspect your muscle size for symmetry and the contour, and they are symmetrical in size. All right, next we're going to look at your gait. So I'm just going to be walk towards the camera and walk the other way. Turn around and walk. Okay, and then you do have equal correct arm swinging with legs, and then I'm going to have you do tandem walking, which is toe to heel. Correct. On your heels. Walk on your heels. And walk on your toes. And I'm going to have you stand still, and I do note good coordination. You're not off balance or anything. Now I'm going to perform Romberg's test. I'm going to have my hands out. I'm going to have you close your eyes. I'm going to stand here for 30 seconds, and I'm just going to make sure there's no swaying or any off balance, and none noted. So now we can move on to your range of motion. we're going to first start with your head. I'm going to have you do flexion, extension, left flexion, right flexion, head rotation, and head rotation. Okay? And now move on to your shoulders. We're going to do flexion, extension, abduction, adduction, arm across, other arm across. I'm going to have you touch your scapula, and then the other arm touch your scapula. Bring your arms up 90 degrees, internal rotation and external rotation. Okay? Next we can move on to your hips or your spine. So I'm going to have you first do rotation. Okay? And then we'll do flexion and extension. And then we'll have you turn around and do lateral bending, and I'm going to assess your spine. I'm going to palpate down for any scoliosis, and no scoliosis noted. Okay, you can stand up. Okay, now we can have you lay on the ground. We're going to move on to your hips. Lying long ways again. Okay, so we're gonna first test for flexion. I'm gonna come under your back here. I'm just going to have you flex your leg up, and then, or extension, and then flexion down. Push against me, good. And then abduction, we'll come out, ab, out, in, adduction, good. And then I'm gonna hold your leg. We're gonna do internal rotation and external rotation. Good. Okay, and now we can move on to your knee. So I'm going to have you bend it a little and extend and flex. Okay, and I'm going to test for your, first we're going to do ACL and PCL. So this is going to be your landmarks jerk, so I'm just going to press inward, okay, and then we're going to do MCL and LCL, and this I'm just going to jerk in, and I don't notice any abnormal movements of the knee there, okay, and next we can move on to your ankle, so I'm going to have you first do extension, and then flexion up, good, okay. And next we can move on to your strength. So we'll have you stand up again. Okay, we're going to start with your biceps and triceps, so squeeze for me. And then extend, triceps, good. And do your lats and deltoids, bring your arms up for me. Okay, and back. Back, good. Okay, equal strength noted. 5s for both of those. Biceps, triceps, 5. Shoulders, 5s. Next we'll do your grip strength. So I'll have you grab my fingers and squeeze really hard. Good. Equal bilateral grip strength of 5. Okay, next we can do your hip. We'll have you take a seat. Okay, we're going to do hip strength, so I'm going to have you push down against me, good, and pull up, good. And push down, and pull up, okay, and that is equal 5 strength. Next we'll do your calves and knees, so I'm going to have you flex, okay, and extend, good. And now we'll do your toes. Forgot we only have to do one side. So I'm going to have you extend your toes, flex them down, and flex up. Good. Okay, and that is equal 5 as well. Okay, next we can move on to your, which I did forget to do, so I'm just going to go back and do your pulses. So I'm going to take a listen, or I'm going to palpate your pulses. We're going to start with your carotid. We're going to do +2 and +2. And then we're going to move on to your brachial +2, radial, +2. We're going to move on to your posterior tibialis, +2, and lift your feet up for me. And then we're going to move to your dorsal medius, +2. Okay, lastly, we're going to test your deep tendon reflexes. So we're going to start with your triceps. I'm just going to have you relax. Relax your arm. Okay. And on this side, relax. Okay. And then we'll move on to your brachial, brachial radialis, and then hover your legs for me, and then we'll do your patellar, and then we'll do your ankle jerk. Just relax. Ankle jerk. And then we'll do your Babinski's. And I'm looking for the toes to curl outward and the toes to curl outward.